When a client experiences a panic attack, which correctly written outcome takes priority. So there are two important focus in this question. One, an outcome that is written correctly, and two, that has the priority. So the answer that I'm looking for, I have to think of prioritization and also that the answer, the outcome is written the right way. So what do I know about outcomes? Two important factors about outcomes in nursing care. The first is that it has to be measurable. It needs a time frame. So that is important. It needs to have a measurable objective data and it needs to have a time frame. So if the answer is not measurable and it doesn't have a time frame, then it's probably incorrect. But then also you have to think of prioritization. So number one says the client will remain safe. So safety means the patient will be taken care of, no harm will be caused. Whether maybe I got the patient in one-to-one observation, or if I need to put the patient on restraints, if it's being violent, whatever the situation is, whatever the appropriate nursing action that I can take that makes the patient safe, that will be a priority. And also, it needs to have a time frame, and it says throughout the duration of the panic attack. There is a time frame. Through the duration of the panic attack, I will keep my patient safe. It has the two factors. And it is a priority because safety is a priority. So for now, I like answer number one. Let's see answer number two. The client verbalized an anxiety level of less than 2 out of 10. So let's talk about this one. It has an objectable measure data, 2 out of 10. That is measurable, but there is a problem. It doesn't have a time frame. And also, it's unrealistic because a patient that has a panic attack is the highest level of anxiety, and you cannot expect an anxiety level of 2 out of 10. This does not make sense. So answer number two I can eliminate for that reason. Answer number three. The client will use learned coping mechanisms to decrease anxiety. Two things. It's not measurable, there's no time frame, and it is not realistic. Why not? The patient experiences a panic attack. The reason why a patient experiences a panic attack is because whatever learning or coping mechanisms that they have is not working or they're not using them. Otherwise, they would not reach to the panic attack level of anxiety. So answer number three does not make sense. Answer number four. The client will verbalize the positive effect of exercise by day 2. A positive effect is a desired outcome in the plan of care of the patient. This contains a measurable or time frame. However, it is not realistic. So we have several answers that are unrealistic 2, 3, and 4. But the most important key factor to make answer number 1 the correct answer is it has a time frame and it deals with safety, which is the priority.